I have worked at Mount Sinai, South Nassau for 5 years. I started working in nursing education, and then I became the language coordinator in cultural initiatives. I've been interpreting since I've started working here and translating documents and doing audits, but I have never thought about being in a situation, and I think none of us here at the hospital ever thought that we were going to be in a situation like this. When I was told that I had to go to employee health to get tested for COVID-19, I immediately started crying. I had a breakdown in my office. I had a breakdown at family medicine outside in my car. And the first thing that I thought of in my head was my 3-year-old daughter, Luciana. I was scared for her life. I was scared for my mother's life, for my father's life, and for my grandmother. Those are the individuals that I live with at home. And I thought I was taking all the precautions that I was told and followed all the proper PPE. I went home, I quarantined myself, I made sure not to expose them, always wearing a mask, door closed. They basically were on the first floor, I was on the second floor as my parents were aiding and taking care of my daughter. I was communicating with my 3-year-old through FaceTime, looking out the window in the backyard as she was playing, or I was at the top of the stairs and she was at the bottom of the stairs, and I would read her a book with a mask on. But it was the scariest. It was very hard for me. I would like to, and I actually put it on my calendar, April 22nd, that as of April 22nd, I could be a candidate for convalescent plasma donation. So I will be signing up, and hopefully next week I will be doing that. I came into work on Monday, still scared, still feared, but I also knew that I had to be here. Surprisingly enough, Monday morning, I want to say that I was called to a patient's room that had to get intubated. He was not able to breathe, no longer on his own or with an oxygen mask. He was frightened. He was Spanish speaking. The whole team that was taking care of him, the medical team, nobody spoke Spanish. I was called to interpret, to explain to him that he had to get intubated and that he was going to be sedated. And I held his hand. He was scared. He didn't have a family member with him. And I held his hand as he was getting intubated, and that was it. But at that moment, I knew that my fear disappeared, my anxiety disappeared, and I knew that I had to be here. Hola, mi nombre es Lina Hoyos. Yo soy la coordinadora de idiomas del Hospital Mount Sinai, South Nassau, en Oceanside, New York. Les quiero compartir con ustedes que yo tuve el coronavirus y sobreviví el coronavirus y volví a trabajar para poder ayudarles y servirles a ustedes. Les quiero comentar de que aquí tenemos servicios de interpretación. Si ustedes o algún familiar o alguien que usted conoce necesita venir al hospital, ya sea por el coronavirus o alguna otra condición médica, vengan, que nosotros tenemos los servicios para ayudarles a ustedes en la parte de interpretación y lo demás.